wanted to talk to y'all about mirror therapy and how it can be beneficial for a lot of patients that we may see in the clinic one day. We really wanted to talk to you about the mirror therapy box and how to make it, when it's useful, and just kind of some of the things that you need to keep in mind when you're making or using your box. One of the really nice things about this one is that it's portable. So not only can you take it from place to place, but also your patients are going to be able to take it with them, whether they're at home or work, or if they go on vacation, that they can bring the box with them, which is really nice. The materials that we used is pretty simple. We just bought a mirror. We decided to go with a square mirror, which is the typical size that people use. And then we bought foam board and Velcro. All of that was about $15 at Hobby Lobby, so it's a very inexpensive tool that we as occupational therapists will be able to implement when we're practicing. So as you can see, it just folds down like this, so it's very portable like I mentioned. And so then what you do is you'll just set it up, and the way that we put the Velcro is on the bottom. You may can't see it because of the light. But what you'll do is you'll set it up to make sure that your ends meet. And you'll just press it firmly. And so what you'll have is the base, and it forms a triangle, but we call it the box. That's where your patient's arm will be going into. And then you'll have the mirror, which is facing the patient's body. And so what you're supposed to do is the patient will stick their extremity in the box, and you'll do your activities, which we'll explain later. Some of the things to kind of keep in mind when making this box is you want to make sure to keep all of the materials in here the same, because you don't want them to be getting a different sensory input. A lot of the things with the mirror therapy box, how it works is kind of neurologically based, talking with the homunculus on the body, and especially how it's represented cortically. You know, your hand has a lot of sensation in your upper extremity, and that's something that this really kind of tries to capture, is kind of tricking that brain into thinking that this is the extremity that's working. So just make sure that you have enough space in the box for the extremity to fit. You want it to be resting comfortably. And you also want to make sure that the mirror makes about a 90-degree angle, because you don't want it to magnify the extremity, and you also don't want it really to distort any of the images, because you're really wanting it to be symmetrical. Another thing, with your patient comes, you want to make sure that they don't have any rings, watches, as I have on. So you would get them to take that off, and also if they have any kind of prominent scarring or tattoos, you want to make sure that that's covered up, so when the extremity is placed in there, that you truly are getting a symmetrical image. So that's really all I have as far as the mirror therapy box, how to make it, and kind of when you're going to use it. And lastly, before Liza comes in, the diagnoses that we really saw in our literature search that this is used with is those who've sustained a stroke or CVA, and also complex regional pain syndrome, as well as those experiencing phantom limb after an amputation. That's not limited to those diagnoses, but that's kind of what we saw as most common in the literature. So that's kind of what we'll be focusing in on today with our video. So I hope that helps, and Liza and Sally are going to be coming in to show you kind of how this thing works.
Okay, so when you're with your patient, you're going to want to make sure that they're in the mid-sagittal plane with the box, so it's a perfect reflection. And you're going to want to put the affected extremity, Liza has hemiparesis, inside of the box, and make sure it's very flat, and copy it perfectly with this side. And as you see, she has on jewelry, and as Martha Ann stated earlier, we're going to want to make sure this is completely off. And you're going to first start with the patient looking into the mirror with their hand flat, just recognizing that exact mirror image. It should feel very symmetrical. And right now you're going to want to really look for any emotional cues, because this could be very alarming to some. And the next thing you're going to have them progress to with this hand is just rotating, supination, pronation. Again, just watching it. And then you're going to have them do opposition of the fingers, tip to tip, each of them. And this will all be done over multiple therapy sessions. And then you can get them to climb up the mirror. And then you'll progress to more functional type tasks. So you can introduce things like picking up a cup. Very good. Using a pen. And again, these may seem very strange, but the purpose of mirror therapy is just for their brain to register that their affected side is doing these tasks. Even a fork. And also scissors. Another thing that was in the research is having them look into the mirror and with this hand doing a functional type task of wiping their face. Because as stated earlier, the homunculus, the hand, and the face portion are very closely related to one another. Very good. And if your person experiences a lot of pain, extreme pain such as like complex regional pain syndrome or phantom 1 type pain, with this hand, you're going to want them to really exaggerate the motions that are painful to them in the affected extremity. So just do it really big. Very good. And if they were a hemiparesis type patient, you would want to start off with just kind of doing some closed chain type activities and pushing through. So placing this beanbag in this hand and make sure the hands are completely symmetrically even. And you can help on this side and just say, watch in the mirror, and we're going to push all the way through. Both hands. Good up. Very good. And again, refer to the handout that you were given on the typical progression of things that you will do during therapy. Thank you very much.